Black Health Matters National and Transnational COVID-19 Impact, Resistance, and Intervention Strategies Project, Global Surveys launch. Welcome, Global Transnational Village, to our Black Health Matters COVID-19 Research Project launch of our global surveys. I'm Dr. Roberta K. Timothy, the Principal Investigator for the project. I'm so honored to be able to share our vision with you today. Today is the International Day for the Elimination of Racial Discrimination. It is observed annually on the day the police in Sharpeville, South Africa, opened fire and killed 69 people at a peaceful demonstration against apartheid pass laws in 1960. I want to start our launch today by honoring our ancestors who are intrinsically linked to lands across our world and who fought for their and our survival. Their lessons and sacrifices have led us to gather virtually today. We ask you to take a second to reflect and honor our ancestors locally and globally, those who have now journeyed, provide the footprints on which we stand today. Next, I will locate myself in this research. I identify as an African woman, womanist, feminist, surviving African enslavement from a working class background, daughter of immigrants via the Caribbean, mother of two, living and resisting with a visual disability in Turtle Island, Canada. I'm an educator, researcher, community organizer, and therapist with over 25 years of intersectional anti oppression, anti colonial praxis experience. I want to tell you why we are conducting this research. COVID-19 has intensified what I call health violence for Black community members locally and globally. It is known that the social determinants of health, including anti Black racism and intersectional violence, discrimination, have a significant impact on healthcare. However, the specific mechanisms and impacts of these systemic barriers in relation to COVID-19 pandemic in the African Black population transnationally are partially known. Black health leaders, health advocates, and scholars have stated that the containment and elimination of COVID-19 requires critical analysis and differential population health actions to the pandemic response. Before COVID-19, health disparities in Black communities globally were intensified by factors such as the social determinants of health, including anti Black racism, housing insecurities, employment inequities, lack of access to health care, and bias in medical treatment. Early indicators of the impact of COVID-19 reported higher risk for Black essential and frontline workers in precarious roles, such as PSW, nursing aides, shelter workers, and migrant workers, to name a few. This research is an effort to collect data by us and for us to support continued resistance strategies and to enhance and develop interventions. These are the main objectives of the research. The first objective is to investigate the impact of COVID-19 on African Black individuals and communities, frontline healthcare workers, and essential service workers, and how systemic structural violence are barriers to effective prevention, treatment, and management of COVID-19 in the African Black population. We also want to identify intervention strategies to respond effectively to the impact of COVID-19 on African Black individuals, communities, frontline health service workers, and essential service workers transnationally. We also want to create knowledge, translation, and exchange opportunities to enhance government, institutional, community, and individual responses to the impact of COVID-19 on African Black individuals, communities, frontline healthcare workers, and essential service workers transnationally. And finally, we want to support community participation and accountability through the creation of advisory committees, both nationally and transnationally. We have a national advisory committee and we're creating a global one. Our Canadian Black Health Matters COVID-19 National Survey was launched in December 2020. Please take it at blackhealthmatterscovid19.ca if you're in Canada. Today, we are launching 4 global surveys in English, French, Spanish, and Portuguese. You can find the survey link at blackhealthmatterscovid19.com. We invite African Black people from around the world to let us know what the impact of COVID-19 has been on your lives and communities. How has anti Black racism and intersectional violence impacted you, and how do you resist, fight back? And what strategies and interventions are useful to deal with the pandemics and to dismantle health violence? Our surveys will be up until 2022. Please sign up for our newsletters to hear about our upcoming events, including focus groups, webinars, and learning institutes. I invite you to continue to watch our video and listen to the diverse voices of African and Black peoples and our experiences during COVID-19. We continue as a global African village to resist against all forms of racism, injustice, and health violence.
Hi, I'm Tandy. I'm a frontline healthcare worker at a community health center in Toronto, downtown. Um, I want to just say that working as a world majority woman working during the COVID pandemic has been stressful. Um, so I can't imagine the world majority folks, particularly the folks of African descent that I've been working with, how challenging it's been with them.
My name is Dr. Afua Cooper. I am a professor at Dalhousie University in the Faculty of Arts and Social Sciences. I teach in the History Department and in the Department of Sociology and Social Anthropology. I'm also a poet and a spoken word artist, and I live in Halifax, Nova Scotia. With regards to how COVID has affected the Black community, I can speak to the Black community in Nova Scotia and also in Ontario. COVID has disproportionately impacted our community in the sense that Black people, especially Black women, work in service industry. They work in the healthcare industry. Black women typically work as nurses, as PSWs, and in other areas of the health field. So they are interacting on a one-to-one with COVID patients. Also, in the last year, so many of the people who have died from COVID-19 have been Black people, Black men and Black women. Another way it has impacted us is that the infection rate among Black people is also very high. So we have, a double, triple whammy when it comes to the impact of COVID on our community. And when I say our community, I mean Nova Scotia, Ontario. And if you look across Canada, you see it's something similar with respect to the Black community. Racism is definitely involved with how the whole COVID situation is articulated in Canada. Again, Black people are at the front line of healthcare. We're the PSWs, we're the nurses, we work in these long-term care facilities, and as mentioned, we're the ones who get, who have a high rate of infection. Black people within Canada also tend to be poorer, to be at the economic end of the ladder, the economic bottom of the ladder. And when being poorer means that we experience food insecurity. It also means that sometimes we don't get the proper nutrition that we need to boost our immune system, because a strong immune system is really essential. It's really imperative to have that in order to fight COVID-19. It's not just a medication, it's also, our immunity, it's the food that we eat, it's the kind of accommodation in which we live. We know it's important to live in a place where it's well ventilated, where we have enough room, where we have enough space to be able to walk outside and get fresh air. And unfortunately, a lot of us in the Black community, our housing situation is compromised.
So, my name is Natalie Wood, and I am an artist, a visual and media artist. I'm a professor teaching at the college level, and I'm also a student completing my PhD at York University. So you asked the question about what has COVID done to the health of Black people and the Black community. And I would have to say that, and what I say to all of my students is that I am existing within not just one pandemic, but two pandemics. I definitely COVID, as we all are experiencing COVID, but also I am very much aware that for for all Black people, that we're also experiencing a moment in time when the experience of violence, the violence that is perpetrated upon us through racism is being revealed, right? And it's a time when institutions and organizations that have made lip service to creating a diverse workforce or creating a work environment that is healthy for everyone, including Black people. This is a time when they're being called to account for what they have done, right? So as a result, what is the result of all of this? In my experience, the result of all of this is an increase in microaggressions. I have seen an increase in microaggressions. I've seen an increase in racism. I've seen institutions creating this kind of bad performance around making things better for Black people. So I've seen the hiring of Black staff, but not enough Black staff, not enough Black faculty, so that when that Black person goes into these institutions, the culture of violence still exists within these institutions, which increases the stress and increases our struggle.
Hello, good day. My name is Masilelian Kishuki. I am a program manager in a women's shelter for women and children fleeing gender-based violence. I am also a PhD student for global health at McMaster University. I want to highlight how the pandemic has impacted women that I have the privilege of working with. Women who come to shelters do not have the privilege of sheltering in place, as a lot of people have those opportunities. So here you see that women are not only surviving COVID, they are also working on negotiating surviving gender-based violence, which has been termed the silent pandemic by United Nations Women, and how all this collides and how all this intersects and how they have to negotiate economic losses. We are aware that a lot of Black women are the ones that have been working at the frontline workers. We are aware that women have been working as personal support workers, and we know how that industry have been affected. We know Black women work under the 5 C's, the cleaning, the clerical, the cashiers, etc., and how those industries are the first ones that had to go. And then when we look at measures that have been put in place, when we look at the policies that are in place for providing support, those policies are not addressing the impact that have on marginalized community. They're not addressing issues that are impacting the Black women.
George Frimpong. I was born and raised in a small village in Ghana, where I had my high school and physics degree. I've also been in Canada for a while with a degree in mathematics education and curriculum studies from University of British Columbia. I've been a classroom teacher, a university professor, and now a full-time researcher as the Director of Research at Demo Paddy Day Learning Institute, DPDLI. here in Halifax, Canada. My research interest has been and continues to focus on developing ideas on how public schools should function to provide opportunities for all children to succeed in learning. The COVID-19 pandemic and the crisis it's created have and continue to impact our work, and most importantly, our thinking of how we can make the world a better place. We've lost so many lives, and others continue to suffer from their exposure to the virus, and most of us are exhausted, unable to do the basic things we love, like being together. The crisis has led me to think of how we could have saved more lives and suffering if we had all accepted the simple solution appealing to our humanity to work and protect each other. It reminds me of the African proverb, it takes a village. It takes a village working together with a collective mindset to succeed. I succeeded because we were all successful. Just imagine how many lives we could have saved if we had a global village with an Ubuntu mindset. Here in Halifax, Nova Scotia, Canada, where I have been since the pandemic, the government has done a pretty good job bringing us together to fight the crisis. The low infection and death rates are testimonies to the success. As Blacks, we have had issues that we had resolved through our traditional advocacy and consultations with the government. The current issue we have now is the disaggregation of health data by race that we are advocating to help us understand how and whether the current COVID-19 interventions are working.
I don't know anybody who lives, like any friends who live near me, like they all like went back home. A lot of them went to different countries, and like so it's just kind of me. I'm just like, hey, everybody went home. Even people like new friends I made this year ended up going home. So I talk to them on a regular basis, but it's not the same as when we used to like go out all the time and go to concerts and go to dinner and do homework together. Like I do Zoom homework meetings sometimes, and sometimes we'll play like video games together online, but it's just not the same. Everybody's birthday too, like this is how like 19 was celebrated for me and all my friends. 19 and 20, a lot of my friends are turning 20 now, and they're doing it in COVID for the second time for some of them, for the second time. And it's just kind of disheartening that these are like the best years of our lives, or at least like the years that we like start to live or whatever, and we're locked in our house. So that's been pretty upsetting. In terms of school too, it's also because I'm in an arts degree, so it's kind of hard to like create from your room and make like films from your room. You can like, there's only so much you can do by yourself. Like being the cameraman and the director and the editor and the writer is difficult. But then like if you want to do a group project, then it's like you have to have masks involved and like distancing, which is like something you're able to do, but it's also everybody's schedule's different and everybody's got the different responsibilities and like requirements and like comfort levels with COVID. So it's been hard to like kind of jiggle those around. And I've had to say no to a couple things that I wanted to do like in real life too on actual sets, because it was going to, it was just not a good idea in terms of safety. So it's also hindering on my real life experience. What I do, like, I feel like everybody those in this boat and everybody like going forward is going to have this kind of lost year. So at least it's like an equilibrium. At least we all kind of have that same boat we're in. No one's really missing out. I know a lot of kids are deferring or dropping out, or just because it's too much at this point. Mental health has been at like an all-time low. So that's been kind of upsetting. But yeah, it's been a good time to like I do this all the time, but like especially in this like any type of project that I've ever wanted to do, like started a business, learned some dances, sing songs, I don't know, read a lot of books, read a lot of articles, painted a lot, met some really cool people all around the world. yeah, it's been a good time to make new friends. It's been a good time to like explore technology and like what we can do in just terms of technology. What kind of jobs there are in terms of technology in the future. We've talked about a lot in class and just what art's going to be like in the next kind of post-COVID world and how technology is going to like factor into that. So that's been interesting. But yeah, it's been a time. I can tell you that. It's been a time. And it's been a time for everybody. Like, I don't know anybody who's been like, oh yeah, this has been a great time for me. Like, we all kind of started off, okay, this is nice, like a little bit of a break, but like, that was when we thought it was only going to last a couple of months. So.
Hi everyone, my name is Phantom Weber. I'm the Executive Director of Africans in Partnership Against AIDS in Toronto. The impact of COVID-19 on Black health in the region, Toronto, and the entire Canada. We know Black people are disproportionately affected by COVID-19. And this is like any kind of disease or viruses coming. We can take example on HIV/AIDS. Same thing, Black health is disproportionately affected by HIV/AIDS virus as well. So COVID also is the same thing. This is what we are seeing in our region and in our country, which is Canada. So I'm going to just talk about Canada because we are living in Canada here. So in terms of what governments have done or the role that they have played, they came into the surface a little bit late. This is my own opinion in terms of funding, because some population have been served before Black people. Black people have been left out regarding the funding. And when we raised our voices to mention that, they came into figure, but it was a little bit late. And also the funding have been distributed to the greater or bigger organizations such as United Way and Red Cross. And then the application also policy was like a little bit, difficult for small organizations or associations for Black community to apply for and get the funding. That also was an impact on Black health.
Bonjour à tous, je m'appelle Mariam Bagayogo, j'ai 25 ans. Je suis jeune diplômée en ingénierie génie mécanique et j'habite en France. À la question est-ce que les jeunes noirs ont été impactés par le Covid en France, je dirais que oui. Même s'il est très difficile de justifier cette réponse, étant donné qu'il n'y a pas de statistiques ethniques en France, cela est interdit. Cependant, on peut prendre l'exemple par exemple de la Seine-Saint-Denis, qui est l'un des départements qui est le plus peuplé par des Noirs et qui est l'un des départements qui a été le plus touché par le Covid-19 et qui a enregistré le plus de morts de Covid-19 en France. Le Covid a impacté les jeunes enfants noirs avec le confinement, donc la fermeture des écoles et le fait de les garder dans des appartements qui sont trop petits et pas assez adaptés pour des enfants pendant trop longtemps. Ces jeunes noirs ont développé des problématiques, des problèmes psychologiques. Et cela se mesure par exemple justement avec la montée des violences dans les quartiers populaires par exemple. On peut dire aussi que le Covid a impacté les parents parce qu'avec la perte de beaucoup d'emplois le fait de rester aussi enfermé à la maison, cela a eu un impact psychologique sur ses parents aussi. Le Covid a aussi impacté les jeunes étudiants noirs, les jeunes étudiants étrangers qui viennent très souvent d'Afrique de l'Ouest pour venir étudier en France. Beaucoup ont perdu leur job étudiant et donc ne sont pas en mesure justement de joindre les deux bouts et même de se nourrir correctement. Donc cela aussi développe des problématiques psychologiques. Beaucoup n'ont pas réussi à avoir de stage pour valider leur année, beaucoup n'ont pas réussi à trouver de travail suite à leurs études. Le gouvernement n'a pas pris de mesures spécifiques pour les personnes noires, mais le gouvernement a pris des mesures générales en mettant en place des subventions pour pouvoir aider les personnes les plus démunies, même si ces aides ne sont pas suffisantes.
My name is Sharon Folksall. First, I must say greetings and also telling the individuals that are asking these questions that I'm grateful. Thank you for doing this. Now, there is 3 questions. So let me start out by saying I consider myself an African Caribbean Black woman. I also consider my displacement, meaning that my family and families are all over the continent, the Caribbean, England, and America. And I am displaced. So there's displacement issues that I come across under anti-Black racism. I also would like to say that I'm, currently or supposed to be finishing off my Master of Social Work program at Ryerson. But due to COVID circumstances, and I find myself at home with low vision issues, and going back to how, as a Black woman living here for over 30 odd years, being a healthcare worker, service worker at one point, but now I consider myself as a user. I'm a user. I am a service user. I find that I'm navigating, I am running through the maze and back. So going back to what I was previously saying, I asked for leave of absence at Ryerson University because when I talked to one of the facilitator about things that I was going to be needing at home, large print computer, software, and softwares to use, I knew at that point, or I knew then, that I have to go through so many stuff meaning legal documents and all the stuff that I just couldn't keep up with. I wouldn't be able to keep up with at that time. So here am I, without the equipment that I need and 3 classes to go. Because I have not yet, I'm not aware, let's say it like that, I'm not aware of like going down to what programs are out there. I'm not aware of the programs that represent the diaspora and represent my identities, my Caribbean identities, and my Black identities. I would like to know of the agencies, yes. So that's why I'm so happy that these questions are being asked, because right now, as currently, in my trying to access resources, trying to access things that I need, I am just not sure where to go and what to do about it, right? And I'm sure there's many, many other people or persons that are going through the same things. Where do we access things that we need?
Majority of us doing this work are Black women, and we're always taking care, but we don't have anybody looking out for us while we're taking care of other folks. A lot of networking to create pockets where we can help folks to access the information, to get groceries to be able to eat. Also, just small grants here and there under COVID hardship, particularly folks north of the city and west of the city and east of the city. Scarborough, Mississauga, and Jane and Finch areas have been really affected. Very little services up there in regards to COVID. And if they've come really late in the game, and it's been really frustrating because the message is Black lives don't matter, even though the message is we're all in this together. We're not in this together because nobody really came out to the Black community from the government to talk about what it looks like for those that have been affected and what our needs would be. So we've had to do it ourselves.
Hello everyone, my name is Bashir Mounye, born in Mogadishu, Somalia, lived in Italy for 13 years of my life, and I've been in Toronto for 26 years. I've been in the food industry pretty much most of my life. I'm a passionate believer that food is a fundamental human right. I really fight and speak for the voices of the multi-ethnic African community, ensuring that our community can have access to wholesome, natural, and dense nutrients food. COVID-19 has really shown much of the impact on how our community have really been suffering systematically. Now, specifically here in Toronto and the GTA, although we are less than 10% of the population, 33% of the overall household that had faced food insecurity, those communities are specifically Black folks. And at the bottom of all this community, it's always the Black woman who's been mostly enduring these systematic issues. More than ever, the government has done very little to be able to address those issues. And people within the food sector, specifically the multi-ethnic African community, have really disproportionately had a major loss. I cannot tell you how many restaurants that I know owned by Black people. They've been around for 20 to 30 years. They actually lost their restaurants. There's been very little financial support, and due to the lack of knowledge on how the judicial system works, due to the lack of opportunity, the lack of the financial resources for us, and primarily because of the gatekeepers, our community have lost disproportionately not only restaurant, but the restaurant lost, the business loss has really had an impact for the overall household. Due to COVID-19, those ones were able to receive $2,000 a month. When you look at the end of the year, it's only $24,000. The Canadian government suggested that 10% of your overall household income should be going to food. So you ask yourself, how does a family of 3, 4, 5 people can only support themselves with a budget of $200 a month?
Hi there, my name is Dr. Ray Reese, and I am an assistant professor in the Department of Sociology at Ryerson University. I want to talk to you today about a population that's often forgotten and erased, particularly in the context of our Canadian landscape, and that is Black women who are incarcerated. My work and my research and my frontline work for many, many years has really been about focusing on misogynoir and the way in which the Canadian carceral state has created jails and institutions as mass warehouses, essentially, for Black and Indigenous bodies, particularly when it comes to Black women who are incarcerated. There hasn't been a lot of research done in this area. And so this is one area of my work and where I'm really interested and concerned about looking to the ways in which misogynoir has been enacted by the Canadian government in terms of the warehousing of Black women's bodies connected to racism, anti-Black racism, gender oppression, sexuality, and just overall negative tropes about Black women's bodies. So we see that historical connotations and historical uses of colonial violence continue to be perpetuated by the disproportionate number of Black and Indigenous women who are incarcerated in Canada due to poverty or property-related offenses. We also know that this speaks very much to the way in which, via COVID-19, Black women who are incarcerated have really been left out of this national discourse. What we have seen with COVID-19 is the exacerbation of mental health issues for Black women who are incarcerated, lack of access to healthcare around some particular issues, exacerbating issues around mental health as connected to separation anxiety, lack of access to visits, lack of protective equipment, and of course, all of this comes on the heels and the continuing issues around racism and anti-Black racism that have been permeating our society for years. So the health pandemic that we are currently experiencing is in tandem with an ongoing racial pandemic that Black and Indigenous folks have been experiencing for hundreds of years. What we've seen with COVID-19 is a lack of government's response to the care for folks who are incarcerated. And this national narrative really speaks to the way in which people who are in jails and prisons are often the forgotten segments of our population. We have an assumption in our society that those who are incarcerated put themselves there, and therefore they are not in need of and should not be given care. And this is absolutely not true. Public health is connected directly to prison health, and prison health is public health. And COVID-19 is not the great equalizer, as has been heralded in mainstream media. COVID-19 has highlighted and illuminated the very indelible impact of racial difference and racism as targeted towards Black and Indigenous bodies, and also the impact and the plight of racialized women within the context of this pandemic. Not only women who are working in care facilities and women who are working as domestics and women who are not essential but sacrificial workers, but it really has spoken to the lack of care and concern around a national narrative about Black women's bodies and in particular Black women's health.
My name is June Francis. I'm the director of the Institute for Diaspora Research and Engagement at Simon Fraser University in Vancouver. I'm also an associate professor in the Beatty School of Business, as well as the founder of the Collaboratorio. I'm the chair of the Hogan's Alley Society, which is a society that's working to redress the displacement of Vancouver's Black community. Like everywhere else, COVID-19 has had a disproportionate impact on Black and Indigenous and racialized groups. Unfortunately, just like it's across Canada, our public health did not see fit to collect race-based data. I believe that the public health response has been inadequate for the Black community. Much of the programs and policies assumed a white normative profile. Much of what we did here was to shelter in place and a variety of public health measures that clearly did not take into consideration situations where many Black people find themselves. They were the ones that often had to go back to work. They're often in unsafe situations from a health point of view. They also did not collect data to help us to understand the impact on our community. And many of the proposals around sheltering in place assume that people had the kind of low density housing to allow this to happen. So I would say that no attention was paid to the particular needs of the Black community. And so I believe that we were disproportionately negatively affected by the public health measures that came into place.
My name is Kiron Diaz, and I am the Executive Director at LAMP Community Health Center in Toronto. I have been working in community health and development for over 20 years now, and loved every minute of it. I have two children who are school aged, and so throughout this year I've been navigating COVID-19 with my family at home, while also leading our organization's pandemic response with my family at work. So it's been an eventful year for sure. COVID-19 has had a significant impact on Black health in Toronto. We've heard a lot about the disproportionate impact on Black communities in terms of high rates of positivity, high rates of hospitalizations and deaths. We've also heard a lot about underlying conditions that lend themselves to people having more severe reactions to COVID-19 and complications with their health, underlying conditions like diabetes and hypertension. While at the same time, we've also heard a lot about Black communities having inadequate access to testing and information about COVID-19 in our communities, and inadequate communication strategies that don't really get the necessary information out to the community appropriately. The economic impact of COVID-19 can't be ignored for sure. Lots of loss of employment, people at risk because they are in employment that doesn't allow for paid sick days. We know that COVID-19 has had a disproportionate impact on women, so we have to look at it through a gendered lens. And Black women, especially, are at that devastating intersection of being a woman and being Black and navigating COVID-19. Lastly, we also need to recognize the historical context of the relationship or around the issues between the Black community and our healthcare system, issues related to trust. And there are lots of examples of why that is. And the issue of trust between the healthcare system and the Black community has come to bear during this COVID-19 pandemic. Anti-Black racism has indeed played a role in COVID-19 and its impact on the Black community. It is health disparities that have long existed prior to COVID that have amplified the impact of COVID in our Black communities. In Canada, we don't collect race-based data. We have largely had to rely on anecdotal information to tell the Black experience in healthcare. Several public health units in Ontario declared anti-Black racism a public health crisis in the summer of 2020 and also called for the collection of race-based data and would start to collect race-based data after that declaration. And that's a great start, but it is still only a start. And we also have to consider, when it comes to race-based data collection, the ethical collection, use, and ownership of data, and ensuring that the collection of race-based data is in fact used to improve the health outcomes of the Black community and not used to further increase disparities in health. So those are some considerations that we still need to make, that COVID-19 has kind of brought forward and we are working through.
It's quite impossible to be able to eat a nutrient-dense diet with a budget of $200 a month. The COVID-19 has really shown in the many layers how anti-Black racism has impacted our community. When you look at the people that are on the bus stop, when you look at the people that are working in the plant factories, in every other aspect of the hospitality industry, at the bottom of all the sectors, you find a lot of young and old Black folks from different parts of the world as well. It really shows the inequities and inequalities that the system built on capitalism, build on the genocide of the indigenous community, and build on systematic racism has really put a dent on us.
My name is Sylvia Perez Drummond. I'm in Halifax, Nova Scotia, and I'm the CEO for the Dalmore Buddy Day Learning Institute. We work in the areas of education and research and community engagement. COVID-19 has impacted the way that we are able to engage with our communities. Our communities are relational, and our previous experience would have been to do our research, to do our education resource sharing, to do our community development practices in a way where we're amongst each other and sharing our experiences. We've had to pivot to do that in a virtual form. We've learned from that quality of engagement the challenges and the opportunities. The challenges have been in that we are not able to control people's access to the resources that they need, and so we had to come up with different ways of doing that. In Nova Scotia, the government has taken the opportunity to be very deliberate in its collaboration with community. This was done in a response to some early identified issues. However, we are positive about the go forward in terms of the collaborations.
Hello, Hello, my name is Alana Butler, and I'm an assistant professor in the Faculty of Education at Queen's University. My research focuses on low SES and education outcomes, and I've participated in a number of interviews and panels about the effects of COVID-19 on marginalized populations, most notably Black Canadians. One of the things we learned about COVID-19 is that it has a disproportionate impact on certain racialized and Indigenous communities. Many Black families have been impacted adversely by COVID-19 because of frontline jobs in retail, healthcare, or in other jobs where there's no possibility of working remotely, thus increasing the risk of contracting COVID-19. Many racialized populations are at a greater risk of losing their jobs due to COVID-19 because of the sectors they're employed in, creating financial and food insecurity for their families. All of these have serious impact on Black mental health. It should be noted that 2020's second virus was the widespread awareness around anti-Black racism and how global protests around the world have affected individual well-being. Many Black community members were engaged in local anti-racism activities, and the myriad of events surrounding anti-Black, anti-Asian, and anti-Indigenous racism in Canada and the United States has taken a toll on their mental health and well-being. The public health response has been slow, but Dr. Roberta Timothy's Black Health Matters project will help to bridge this gap through gathering data and listening to the stories of Black Canadians and their experiences with COVID-19.
Hi, my name is Anab Mahmood, and I'm a recent global health graduate from New York University and the current research and administration assistant for the Hoya Project. When we're looking at Black health and how it's been impacted during COVID-19, it has been impacted severely when we're looking at our mental health, our physical health, also even our social health, our interaction with friends and family, and having to socially distance and stay within our bubble, so to speak. So it's really impacted a lot of our lives in so many ways. And I think when we look at so much Black communities, Black community members specifically, also being frontline workers, being essential workers, and working during this pandemic nonstop, and having increased exposure to people with COVID-19, and how that can potentially harm them, it can harm their families. And when we're looking at Black communities, a lot of us come from multi-generational homes. We have grandparents living, we have aunties, uncles, some of us have like a lot of siblings and cousins and so forth. So that just brings an increased risk to our community and our population, right? And I think that's really, really alarming. And when we're looking at the government's response and public health and how they've kind of reacted to it, we, in a sense of the government with the benefits and how they've brought forth systems in which it can help alleviate some of the pressures of community members, I think, and I would argue it's not enough, because a lot of the times when you're looking at benefits, you can only take them, every 2 weeks, or they have an expiration date. So it's like, what happens when it ends? And a lot of us have faced unemployment. A lot of our hours have been reduced. A lot of us have been laid off in the beginning of the pandemic because businesses just can't, especially small businesses, just can't support and take on that responsibility during that time. And a lot of corporations are trying to cut ties and trying to cut costs a lot of ways, and that are impacting a lot of Black families and Black community members living alone, especially within the city. But when highlighting, some of the plans that the city has unveiled, City of Toronto specifically here in Canada, and seeing recently they, in February, have unveiled the Black Community COVID-19 Response Plan, which is in response to the disparities in the COVID-19 rates in specific communities in Toronto. I definitely think that is a step forward, but again, addressing those public health disparities has always been there. This is nothing new. It's just been exacerbated under COVID-19 and the conditions that we're currently in. So I'm hoping that we move forward from this, but we're also understanding that things like anti-Black racism and how it's just last summer, it's just been named as a public health crisis. And again, you're kind of stunned, like, how has this not been addressed before? How are we now just coming to that realization, right? So a lot of that has happened, and I don't like to say the pandemic has pushed these issues to the forefront, but again, we got to keep the momentum going.
In our congregations, there's been a significant impact by COVID-19. As with many in the Black community, we have a number of individuals that are frontline workers, and they are overrepresented in our country as a whole and overly impacted specifically. So we've had a lot of issues with mental health. We've been blessed by not having too many cases of COVID in our particular congregation, but as a whole, there's been a number of cases throughout the Adventist congregation communities in Ontario. Speaking in the beginning of the pandemic, really the government response was behind the curve. The public health response was behind the curve. We only recently started collecting data that showed that communities of color were being impacted more financially and health-wise than other communities in Canada. Furthermore, a lot of this was not being recognized or acknowledged at a frontline public level until the incident with George Floyd in the United States. Then we had more public leaders speaking out against racial injustice, but still it's behind the curve. And even now, they're still trying to grasp the concept that communities of color require more additional support in terms of information about vaccines and the community health response.
Soy Norma Guillarle Monta, santiaguera, dedicada a la especialidad de psicología social, y por muchos años presido, incluso ahora en mi etapa de jubilación, una sección de investigaciones relacionada con la identidad y la diversidad. Y desde ahí me presento como una activista feminista, afrofeminista, centrada en vínculos con espacios que defienden estos temas, con los que intentamos lograr alianzas. Diríamos como impacto es que por lo regular viven de forma en casas más pequeñas, y cuando se habla de confinamiento, el confinamiento ya implica no salir y estar en la casa. A veces familias de 3 generaciones se convirtió en una situación en que hubo que llamar para saber si podía hacer apoyo con relación a la violencia de género, y así se creó un espacio telefónico donde se podía llamar para dar esa asistencia, y a su vez tener una especie de conocimiento de forma general de cómo se iban viviendo estas realidades y dónde que estaban los fundamentales problemas. Y en estos momentos en que el COVID se ha presentado como una realidad difícil, pues encontramos que existe una relación, como así lo dijo la palabra, difícil con esta situación, debido a que precisamente la población negra acá en Cuba ha seguido siendo una población que suele vivir en los barrios que son vulnerables.
Je m'appelle Pascal Diade, je suis professeur assistant à l'université de McMaster à Hamilton en Ontario et au Canada. Je suis d'origine africaine, nationalité canadienne, et la COVID-19 a eu beaucoup d'impact dans la communauté d'où je viens. Je veux dire, les Canadiens noirs d'origine africaine qui parlent français et francophone ici à Toronto. Et surtout, la COVID a eu un aspect négatif sur la structure communautaire en tant que telle. Donc les rassemblements ont été suspendus, les réunions ont été suspendues, les rencontres intercommunautaires ont été suspendues, les activités sportives et les activités des enfants ont été suspendues. Et je crois que au niveau, et même sur le plan communautaire, il y a eu beaucoup de décès dans la communauté au niveau des parents qui sont restés en Afrique. Moi-même, j'ai perdu mon père pendant la période de confinement et je n'ai pas pu voyager pour assister aux obsèques et à l'enterrement. Donc je dois dire que le gouvernement au niveau de la réponse a été très effective et très stricte, et ce qui fait que euh, il y a eu pas mal d'impact qui a été reporté au niveau euh, du racisme anti-noir.
We at Hogan's Alley Society, I'll give you as an example, there was a tremendous response in British Columbia. As an example, the Hogan's Alley Society has worked to support the first temporary model of housing, to our knowledge, in the country that prioritized Black and Indigenous people. And this allowed us to focus some of our attention on the most exposed and perhaps the most marginal and the most vulnerable groups in our society. We kicked into gear and had a task force struck from members of our community and wider community where we delivered a variety of foods and Black products and advocated to try to support people, especially in these congregate living situations, to shelter in place. So we had an enormous response from our community. We did things like provide phones and phone plans so people could call their families without having to leave their homes and could stay in touch. We also tried to connect people to public health resources to help them understand how to best protect themselves.
So what we've seen with folks who are incarcerated is we've seen not only numbers being increased in terms of the transmission of COVID-19, and we've seen a lack of PPE equipment for prisoners, of course, a lack of access to communication with family members. So visits have been cut off. And for folks who know anything about prisons and jails, access to your loved ones is an incredible supportive mechanism that's part of how folks do their time. And it's very important to keep that connection. So we've seen very little government response until political pressure was put onto the provincial government by local grassroots groups that folks that are sitting on remand and folks that really don't need to be incarcerated for poverty or property-related crimes need to be released, particularly during this health pandemic. And we saw the Canadian government, the provincial government in particular, release a number of prisoners during the pandemic who were on remand. So that very act tells us that it's quite indicative that folks didn't really need to be there in the first place. If there was a provision that was put in place that could have released people back to the community until their court dates, then that provision could have been put in place in the first instance. So in terms of Black health mattering, in terms of prison health mattering, prison health matters because Black health matters, and Black health matters because prison health matters. And due to the fact that there are a disproportionate number of Black and Indigenous folks who are incarcerated for nonviolent offenses, not only in Canada but in the United States, this is a conversation that we really need to have. It's a conversation we need to have to not only bring to the forefront the plight of colonial violence and the history around colonialism in terms of its impact on Black women's bodies, but also the way in which Black bodies are marked in our society as deviant.
And one of the ways in which Black people are resisting COVID-19 is through self-education and is through community education. I know here in Halifax, Nova Scotia, there continues to be workshops, community awareness programs with regards to COVID-19. And these programs are put on by health care professionals from the Black community, social workers, academics, nurses, doctors, and other informed people. So that is happening. That is happening throughout, and people are also self-educating themselves. People are also connecting with friends and families, if it's even through Zoom, to ensure that we have the proper mental health support. We know that it's important to touch base with each other to say, hey, how is it going? Do you need food? Do you need, if you're able to walk, do you need a walking companion? Do you need someone to exercise with? Do you need to walk with someone along the ocean, the beachfront, the seaside? In Nova Scotia, we have beachfront we can walk on, or along the lake. So I think people are more conscious than ever to reach out to other folks, because COVID-19, it has sent people inside, and the loneliness factor.
It's just been upsetting because I can't really go out and like participate in these things, and I felt really difficult, like very disheartened that I couldn't help in person. So I tried everything I could from here, lots of petitions, lots of raising money, but I just really wanted to be a part of it. But if I do, it's gonna like have repercussions on my family because they're more susceptible to getting COVID, so I can't really do that. And that was kind of hurtful, that I just felt like I wasn't doing my part, so I had to like try everything I could.
Being there for each other and being our sisters or brothers keepers, as we continue to provide support, as we continue to advocate for our silenced communities. It's not that we don't have voices, we do have voices, it's just that our voices are silenced. And for those who are in positions to advocate and for those who are in positions to talk, should be participating in dialogues to see how we can further advocate to ensure proper supports.
I can say Black people have been always resilient. So resistant fighting is having meetings, calling upon the Prime Minister or the Minister of the Family or the Minister of Immigration. You can name them. So they had to stand up for their own life in order for government to respond to them. So this is a resilience for Black communities wherever they are.
How do I resist anti-Black racism? In the healthcare system or any other system? That's a hard task. This is why I consider myself lucky, because I always go back to community and I always go back to my community sisters for support.
I think we resist the ways we usually resist. We resist by walking around with our cell phones to document the violence, but also we resist by organizing, by reaching out to each other, by focusing on the health of our communities and the health of ourselves. So, for instance, I've heard that there's been an increase in Black people reaching out to do therapy. And in fact, it's very, very difficult to find a Black therapist who is free and available in Toronto.
Les personnes noires se sont organisées de façon spontanée sur les réseaux sociaux en créant des petits groupes qui organisaient des collectes pour pouvoir aider les personnes en besoin, comme par exemple en organisant des collectes de nourriture, des collectes d'argent pour pouvoir aider les personnes dans le besoin. Mais aujourd'hui en France, il n'y a pas eu d'aide spécifique du gouvernement ciblée pour les personnes noires.
Donc, au niveau de la COVID, je crois que la communauté noire, dans son ensemble, résiste autant qu'elle peut, au-delà des autres problèmes structurels qui existent déjà dans le domaine de la santé et d'autres problèmes d'intégration et d'accès aux soins. Donc, ça a plus ou moins impacté cet aspect-là, mais la communauté noire résiste autant qu'elle peut. Donc, sur le plan des programmes et des interventions, personnellement, j'ai participé à des programmes d'information au niveau de la COVID et je sais qu'il y a pas mal de programmes qui existent, qui informent les gens sur l'impact de la COVID-19 et sur ce qu'il faut faire et ce qu'il ne faut pas faire. Il y a l'accès au vaccin, il y a une réticence au niveau de la communauté, mais je crois que il y a pas mal d'informations à ce niveau-là qu'il faut, promouvoir. Il faut promouvoir le vaccin et informer la communauté de ce qui se passe. Donc, je crois que la santé des Noirs est importante parce que la communauté noire et la communauté africaine, la diaspora, a beaucoup de problèmes. On parle de racisme anti-noir, on parle du racisme systémique, des problèmes structurels, l'accès aux soins. Et je crois qu'il faut continuer à promouvoir cet aspect-là pour qu'il y ait des changements au niveau des politiques et des polices. Merci. Et puis, je crois que le combat en fait continue. La COVID-19 n'est qu'une étape, mais je crois qu'après ça, il faudrait continuer à travailler sur l'information, sur la dénonciation de ce qui se passe au niveau de ces communautés et pour qu'il y ait au moins la santé pour tous, du moins au niveau du Canada. Merci.
Buscaban la manera de subir, de aumentar el sistema inmunológico. Realmente han sido un esfuerzo muy grande del gobierno. Ya nosotros tenemos una vacuna más que probada, que es la Abdala, que ya está puesta en práctica en las provincias orientales. Y aquí en La Habana está la Soberana 2, y todo eso le va dando mucha tranquilidad realmente para enfrentar estas dificultades. Para hablar del impacto que ha tenido en la salud y sobre todo en la población negra, debo apoyarme en diferentes espacios que existen, algunos de ellos independientes, que llevan durante algunos últimos años trabajando el tema del desarrollo, de la autoestima y sobre todo de enfrentamiento al racismo. Muchos de estos espacios están declarados así como antirracistas.
Well, I have joined a movement to talk about the injustice and women's movement. And during the COVID time, I have been really trying to stay positive. And that means that connecting with my sisters, connecting with support groups. Now, I talk about my displacement, right? And I talk about being Caribbean. And lucky for me, there's a WhatsApp, is that how you pronounce it? System that I can connect with home. And through that, I use that on several occasions.
And I'm just very grateful for the work that's been going on by different people in the communities to, get messages out, whether it's been Women's Health in Women's Hands, Parkdale Queen West CHC.
But our community have been fighting, have been showing resilience, and we've been resisting. A lot of our community organizations, they've been trying to find different ways for the community to have access to food more than ever. There's been a lot of programs, and I want to really give a great acknowledgement for those people that for the past 25 years have been really focusing on ensuring that the Black community can have access to food that is also culturally appropriate to us. There's been the Black Food Sovereignty Conference led by the African Food Basket. There's been fantastic work that has been done by Food Share, which has been really focusing on how to ensure that the community, specifically for the Black folks, to ensure that they can have a food received to their home for free, and the fantastic work that the Black Creek Community Farm has been doing, the largest urban farm setting in Canada.
In terms of Black communities resisting and fighting back against anti-Black racism during this time, throughout this pandemic, the disproportionate impact on Black communities has been a focus. And at some points, it almost sounds like, being Black means you're susceptible to contracting COVID-19. And that's absolutely not the case. I think we need to focus on the fact that it's the disproportionate the inequities in healthcare that have created these disproportionate impacts on the Black community. And those are what we need to focus on and remedy if we're going to make any tangible changes.
So a number of community organizations have come together to take the lead in ensuring that the disproportionate impact that's being felt because of COVID related to health and education disparity is somehow addressed through this community public sector collaboration. Folks are resisting the issues by having their voices heard. We do that through our policy work, so we've evaluated and given advice about how policies are not generic and the disproportionate impact of that. We continue to be a voice for the need for data. We do that from our own research analysis perspective, and we do it in collaborations with community organizations such as the Health Association of African Canadians, the Association of Black Social Workers, to name a couple that we support in their leadership and collaborate with them.
Black people have fought back through the formation of supportive networks that are both formal and informal. Black health matters because Black Canadians continue to experience systemic racism, and this adversely affects our spiritual, physical, and mental well-being.
Y esto hizo que se prepararan actividades diversas por esas mismas espacios en las comunidades que radican. Tenemos, por ejemplo, que en barrios como La Lisa existe un espacio llamado la Red Barrial Afrodescendiente, y en esa red, dedicada fundamentalmente a las mujeres, pero que enriquece a toda la comunidad, encontraron maneras de conocer las diferentes dificultades y se prepararon nasobucos, es decir, mascarillas para donarles a quien lo necesitara. En esos espacios hay personas que trabajan en el arte como de muñequería y dejaron un poco su arte para dedicarse a hacer nasobucos y a repartirlos en otros barrios como Cocosolo, barrio también marginal de una comunidad mayoritariamente de afrodescendientes. Encontramos experiencias como que hicieron hasta jabones orgánicos y buscaron la manera de a la persona de la tercera edad llevarle, conocer sus dificultades y llevarle a la casa apoyo de diferentes tipos. Una de las particularidades que pudiéramos tener como experiencia aquí en La Habana, si vamos a hablar de resistencia y de apoyo de la sociedad civil, está vinculado con espacios como el de Afrodiverso, que es un espacio caracterizado por un trabajo de visibilización de mujeres, de transformismo, de mujer para hombre. Y este grupo ha logrado aglutinar y acercarse a este espacio de personas también vulnerables y ha buscado la manera de darle apoyo y de conocer dónde están sus familias y qué apoyo necesita su familia.
And I think Black people have always been resisting, and I think that's the beauty of it. We're always, we're fighting back, and we're not just looking at these rates for face value and just saying, oh, well, that's just kind of the life that we succumb to. Like, no, like at the end of the day, we deserve that equal treatment. We need to ensure that, you know, our community is taken care of. And I think Black folks have really stepped up to the plate in ensuring that, you know, our voices are being heard, and that policymakers, when making policies, they need to ensure that all communities are, like, all communities are part of it, but specifically looking at the Black community and the disparities that we face during this pandemic, and even way before this pandemic and the issues that we have been dealing with. And looking at innovations and projects, there've been a lot of great initiatives that come out from it. A lot of, you know, health clinics that have really specifically come out with programs specifically geared to Black youth, students, families, and adults, and especially those who can't really, especially those who can't really afford mental health services. I know it's pretty expensive, and sometimes right now more than ever, we're really trying to cover our basic necessities. So hoping that that becomes more accessible for a lot of us, especially within this pandemic. It's really, really tough. And then I'm looking at research projects like this, for example, Black mental health, and how they're really trying to tackle this issue, and looking at all four corners of it, looking at the numbers, how can the resources be allocated properly. So I'm really appreciative of a project like this, and I'm also appreciative of the Hoya project that I'm also a part of. It's a recent project that, you know, has started last summer, well, last fall, so to speak, sorry. And our team has really tried to bring forth those workshops that are talking about understanding COVID-19. How do we work with community members in understanding the vaccine? Vaccine hesitancy is really big as well. So how do we, you know, address their concerns and let them know that it's valid, but also, you know, coming from a place of understanding the importance of taking care of your health, and you know, socially distance, and the importance of the vaccine can really help alleviate some of those pressures.
In our local church, we have taken a number of actions. We've began specific discussions, not just discussions, but actions. First, recognizing the impact of not only COVID-19, but the systemic racism that results in the over impact, if you will, on our communities. We've had specific specialists like an immunologist come in to talk to our community about the vaccine and how it's made and address concerns. We've had public health officials come in to talk to our communities, to give them information, to discuss things such as vaccine hesitancy, so our members, our community, can make informed decisions. It's about taking back the knowledge that often is not given to us, but leveraging the fact that in this day, in this time, with this technology, we can truly inform ourselves separate and apart from other systems with quality information to help us not only look after ourselves, but share that knowledge with other communities so that they may attend to their needs as well.
Hi, my name is Sophie, and I'm a frontline worker. Obviously, the pandemic has really created a lot of challenges, and those challenges have been felt much more by racialized people. Racialized communities have suffered the most. But as a frontline worker, also coming home to my own family, I have felt the challenges of being at work, seeing my co-workers, and being with people who are people of color that I primarily work with, struggle with keeping their mental health in check during the pandemic, and also coming home to my family and trying to keep them safe. So I'm going to demonstrate some of the things that I have done for myself to keep safe and to also stay balanced during these COVID times. COVID has not stopped Black people from celebrating themselves. We recently celebrated Black History Month. We did it virtually with our friends and with our families and at the workplace. We also have continued to have over Zoom and over FaceTime meetings with our friends, touching base with our family members who are far, far away in faraway lands. So I want to celebrate Black people and invite them to keep their spirit and to always know how very strong they are, and to continue to demand for change for themselves and for their communities, that the government takes notice
and puts the resources in these communities. So I also teach yoga as part of my self-care. Every day I practice yoga and every day I do meditation. I also go for regular walks. Those are all things that anybody could do safely or with a group of small groups of family members who reside in your household. I will share with you a few moves that you can do in your own house. If you are able to stand on your own, you stand tall, or if you have some mobility issues and need to hold on to the chair, a kitchen chair just like this, very helpful to help you with the balance. And so let's start the yoga. Inhale to breathe in. Exhale, bring your hands down to the side. Inhale. Exhale, bring your hands down. Inhale. Exhale. Holding on to the chair. Inhale for big stretch on your right hand. Exhale to bring it down. You can turn around. Inhale for big stretch on the left hand side. Exhale, bring it down. Turn around. Let's do that again. Inhale. Exhale. Turn around. Inhale. Stretching both sides. With yoga, you're always balancing yourself. And now that we're here, you can use this chair for balance to do a little bit of a tree pose. Inhale, exhale, at the side, inhale, exhale. And then now mindfulness. You can do this in your kitchen, you can do this in your bedroom. When you're ready, come down with me on the mat or on the floor. You can use a cushion, like I am going to use my pillow here. Help myself to protect my knees by putting my knees on my pillow. I can lean back ever so gently to stretch my back and my shoulders. It's a really good stretch for those of us who are always working on the computer or we are lifting at our workplaces. Keeping breathing and stretching your back. When you're ready, come right up. Do that for about 5 minutes. And when you're done, some of those poses like I have shown you, you push your chair away, you lay still, bring your feet on your pillow, lay back down, lay yourself gently on the floor, just like I'm doing, and relax. Allow yourself to melt into the floor and keep breathing. At the time you're breathing, you can bring your hands to your belly and say strong affirmations. You can say, I love myself. I am strong. I am worthy.
Black health matters because Black people are important. We're part of humanity. We have struggled and we've suffered for so long. And now COVID has, it has impacted disproportionately our physical health and also our mental health and also our emotional health. But I see, to quote, paraphrase some words from Bob Marley, collective security for surety. We can't make it on our own. We have to reach out to each other, to our brethren and our sistren, to members of our community, and they have to reach out to us. And we just really have to think collectively as we fight this pandemic.
So to answer that question, Black health matters. I matter, right? My health matters, my daughter's health matters, my partner's health matters, my family matters, and I go back to that thought, that statement that our ancestors dreamt us into being. We are the dream of our ancestors. And I hear the call of my ancestors right now asking me to dream into being a healthier, vibrant Black future for everyone.
Black health matters. Black health matters, true, but all health matters. Why we said Black health matters is because always we are at the last to come into the figure, to come into the surface, to come and claim. It's kind of like we don't see us. And if you look at it statistically, Black people have been really, really affected by this COVID-19. And also they are frontline workers, but they have not been recognized. This is why we said Black health matters.
Protégées, elles n'ont pas été accompagnées dans cette démarche-là. On a pu voir beaucoup de grèves, par exemple la grève des éboueurs, la grève des femmes de ménage, la grève des agents de sécurité en France qui se sentaient exposés au Covid-19 et pas assez protégés par l'État. Pour moi, la santé des Noirs est très 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 importante pour le bon fonctionnement de l'économie française, étant donné que beaucoup des jeunes Français sont noirs et sont l'avenir de demain, donc il faut les protéger psychologiquement et même physiquement.
We're talking about stuff, we're networking, we're trying to get it out by any means necessary so that we can save lives in the Black community because, you know, there again, our lives have never been seen as value and even more so now. And we're basically, you know, expected just to sit back and watch our folks dying and no support for that. So I'm glad for this project that's going on. I think it's been very instrumental and helpful to get out awareness, give voice to the Black health matters that are being affected currently.
Black health has always mattered. It has mattered during the pandemic, before the pandemic, and it will matter well after the pandemic. And I'm really fortunate to know that Black people are constantly at the forefront and trying to address these problems with sustainable solutions.
I think about it as a race car that enters into the pit stop. All of the workers come out and they change all 4 tires. They don't leave one on. They make an equal investment in all 4 tires because they know that the car as a whole has a better chance of winning the race. You know, Jesus says also in the Bible, in John chapter 10, verse 16, that he has many flocks in many different places, and he wants to bring them together to be whole as one family where he is their God. If Canada is to reach its full potential, if we are to be one family, we can't have communities that are left behind. It is as if we're leaving the one tire on. There's no way we will successfully finish the race. We have to invest in all communities, the Black communities and all communities equally. We have to invest to ensure everybody has the equal right and ability to be able to achieve their full potential. That's the only way this country will truly succeed among the nations. And if we are able to do that, if we invest equally and able to serve each other with equity, then we truly will be a country that is inspired and modeled after throughout the world.
Black people, we are contributing members of society who deserve access to great health care. We're essential workers, we're teachers, we're healthcare workers on the front lines of this pandemic response. We're students, we're educators, we're members of the broader community who deserve the attention necessary to make sure that we are deliberately planned for in our health system. We've seen the impact of, Black people's health being an afterthought in the health system. And now if our health system leaders who have put out statements of solidarity and commitments to addressing anti-Black racism are really intentional about living up to their commitments, then the Black experience in healthcare, the the Black health on a whole needs to be deliberately planned for in our health system. And so this moment is one where we can start to make that change. And hopefully, it's a moment that we really take advantage of and make sure that we capitalize on this momentum to really acknowledge Black health and the deliberate attention that needs to be paid to it if we're going to see some change.
COVID-19 more than ever has really shown many of the systemic issues that really been having impact on the Black community. Black health matter because for those of us who've been forcibly migrated to come to Canada, we had experienced an immense amount of trauma. On a daily basis, the lack of this financial support, the lack of the housing, and the lack of many other needs for the Black community, those issues really have a major impact on our health. For myself, as a Somali person, we have seen more than ever how our community have been having disproportionately high amount of diabetes, cholesterol, and also having heart-related issues, primarily because of the lack of a proper diet as well. Black Health Matter. I just want to say thank you so very much for all the organizations that have been fighting, advocating on a daily basis to ensure there is equity within our own system, fighting for justice as well.
Why does Black Health Matters? So the short answer to that, Black Health Matters, is because we matter. Black Health Matters also in terms of the broader community because health is one of the determinations, has education as one of the determinants in it. And so it's important that we strive to get this right, because when we get it right for organizations such as ourselves, we can work collaboratively with folks to strengthen that. And when we get it right for the communities that have been, and in our case here in Nova Scotia, historically marginalized, then the larger population will benefit.
Oh my goodness, it matters because the first thing is that we have our own unique health challenges and our situations, but most importantly, because we have been excluded from much of the research and development that has taken place, that has largely paid attention to the white normative patient and has excluded and not paid much attention to many of the diseases that affect us and affect the countries we come from. Plus, we know that within healthcare settings, we tend to be discriminated against. And so it is so critical for us to achieve the same level of well-being. It is important that we address the disparities in the health impacts, not only in the healthcare system, but also the health impacts of racism per se in other aspects of our lives.
Healthy Black lives through the village with an Ubuntu mindset is a win-win for everybody. Black health matters.
It takes a global village to address the impact of COVID-19, anti-Black racism, and other forms of intersectional violence on our local and global communities. Thanks so much for attending today and watching our global launch. Thanks to all the voices who participated in the video and in the back scenes. Special thanks to OneTrackMind.ca for the creative video production skills. Please take our survey at blackhealthmatterscovid19.com. You can follow us on social media via Twitter, Facebook, Instagram, and LinkedIn through the handle @BHMCovid19. Once again, please take our surveys at blackhealthmatterscovid19.com or blackhealthmatterscovid19.ca. Black Health Matters. It takes a global village.
And start.
So, tell me a little bit about yourself. Who are you?
I am 6 years old. I am a Black girl. I am 7 years old, almost turning 8. And I'm a Black boy.
And where do you live?
I live in Canada. Me too.
And can you tell me a little bit about the impact of COVID-19 on Black children here?
It's impacting a lot of children, especially Black children. And if COVID-19 was not here, lots of people would be doing different things like having fun, going to the park, celebrating birthdays, having big celebrations together.
That's true. And what do you think the impact of racism is on Black children here?
Well, sometimes white children kind of like do bad things to black children because of racism.
And also, it's because the color of their skin. It's like a no reason.
And what do you do in terms of resisting, and how do you fight back against COVID-19 and also against racism and other types of violence?
Well, scientists tell scientists to find the cure as fast as they can. And also tell people that Black Lives Matter.
And for me, I think the best way is to wash your hands, take good vaccines, and for racism, I think do protests, a protest that will hopefully end racism forever.
And why do Black health matters for children? Why do Black children's health matter?
It's because, well, lots of children around the world are poor, and lots of children around the world have COVID, and lots of children around the world are impacted by racism. I can't believe I used that word.
Do Black health matter?
Yes.
And do Black children's health matter?
Yes.
Yes.
You want to say anything else?
Yes.
Okay.
Well, explain all of that can take bravery and lots of learning. That's why I listen to my teacher. So
yeah, me too. I listen to my teacher. She's almost the funniest teacher in the world.
Thank you so much.